what is exactly that Marsh guides their clients, and do they do come and suggest to their clients, take MHFA, take mental health first training for your corporate, as another action towards reducing the risk to it. Is this the approach towards that prevention and early intervention and empowerment of people, and having people not waiting till they become ill and then we start claims and other concerns?
Absolutely. You're absolutely right, Arinda. Uh, 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 I have seen an increasing focus of prevention. And as the very well-known verse says that prevention is better than cure, which it's absolutely true, not just in the case of mental health, but also in the case of physical health. And in terms of physical health, we say that, hey, why don't you go and exercise so that, you are fit and you don't injure yourself and things like that. But even in terms of mental health, uh, I personally feel that there is lot of need to sensitize people. See, for example, okay, I bruise my hand. I go and walk up to my parents and say, "Hey, I bruised my hand." What will they do? They'll come with Dettol and Band-Aid, and they would, patch me up. Hey, and they'll say, "Hey, you take rest, okay? You don't need to do anything, right?" But what if I just, walk up to my manager and say, "Hey, you know what? I feel stressed. I don't feel like working today. Uh, I don't know. I don't know what it is, but I don't know, but I feel stressed." What would my manager say? Will they do some similar sort of patchwork and tell me, "Hey, you know what? You take rest." In many situations, Erinda, unfortunately, uh, the reaction is very different. Now, here comes the role of awareness and
Mm-hmm.
being present, that mental wellness is something which should be taken care of. And that is where I think MHFA plays a very, very important role in sensitizing. And it's not just MHFA, but there are a lot of other programs as well. And I would like to highlight that it's a lot of it is also available now
Mm-hmm.
in today's internet age. And
Yeah.
you definitely walk up to the internet and read it. But at the same time, being a mental health first aid, I would just want to open this up to everyone, and I'm sure every mental health first aider would be happy to volunteer. Uh, in case any one of you have any issue, and you can confide in someone who you can talk to, and if in any case, if that is me, please feel free to come up.
Thank you.
uh,
Thank you for offering yourself. Nevertheless, despite, I mean, as you said, data said that says that only 1% of claims, insurance claims, are from mental health, for mental illness. So there's a lot of a long journey to go ahead. Thank you so much, Anurup, for bringing your perspective and maybe as well giving and sharing information that would be useful for the people.